improving eye health and reducing sight loss, a call to action.
We have taken views from members of the public and the profession in producing this video on eye health. We hope you enjoy what you see.
How can we secure the best value for the financial investment that the NHS makes in eye health services?
We should make better use of existing community assets so that we can make cheaper and more focused investment in the community, for instance by using community-based optometrists who can provide cheaper low-cost services to people in their locality where they perhaps are more trusted and able to reach people in harder to reach communities.
And obviously everyone believes it's going to cost you a lot of money, even though I think the reality is it doesn't, but because my eyes are quite good, they're probably not as good as what they should be, so I believe that I don't need to have a look. Only when I look at newspapers up close do I have a problem. But other than that, my eyes are fine, yeah.
How do we best utilise the current pathways to enhance disease prevention and develop integrated services?
My appeal today would be that we put the patient at the heart of our services, design the service around the patient, not try and fit the patient into the service. We need to engage with the public, what I'm going to call the EastEnders effect. Get a storyline in a television programme like EastEnders that really impacts on the public at large.
We need to stimulate eye health awareness at all points of the healthcare radar, in hospitals, pharmacies, dentist practices, GP surgeries. Simply asking the question, have you had your eyes tested within the last 2 years?
How do we increase uptake of routine sight testing and access to eye health services?
Using other healthcare providers to educate patients in respect to eye care and eye health, for example, in GP surgeries, pharmacists and possibly dentists. We consider that the general ophthalmic services as it stands at present is not the best way to provide primary eye care, and this should be looked at and probably revamped. This would have to be done right from the top, from the via the Department of Health.
I think one of the most important features is to develop a better system of joint working between primary and secondary care. The primary based opticians, the high street opticians, are ideally placed with access late nights, Saturdays, weekends, to actually relieve some of the burden on the secondary care people. We have the dedicated professionals who are enthusiastic about looking after this group of patients, and we're situated where the patients want to come, to their local opticians.
And for a long time I did buy cheap glasses off the shelves until things got better for me and I could afford, even though I was working, I didn't get any benefits, so I couldn't afford it. So by the time I could afford to get my eyes tested, they'd got a lot worse, probably worse because I'd been wearing the wrong things. So I think it should be available to anybody that works, as well as people that don't work.
How do we best involve service users and their carers in the development, design and delivery of NHS services for eye health?
A regional or national one-day survey across all stakeholders, primary and secondary care, voluntary sector and adult social care. This would then give a reflection across ages, genders, eye conditions and the reasons that people are accessing eye care services on that particular day.
Eye health stakeholders must ensure that carers and service users are engaged when considering and developing strategy and services for eye health services.
What is the potential for transferring more elements of eye care from hospital to community services?
Predominantly we were talking about the integration of services to create multidisciplinary teams rather than silo working across the community. The whole care pathway, to put the patient at the centre of the whole pathway service. And we talked about integration specifically about IT as well. This will only work with integration for IT, so everything's drawn together, particularly when we're getting feedback.
I think there's plenty of evidence out there from schemes that are up and running at present across the UK, particularly for things like red eye and minor eye condition services, that the community opticians are the best place to see these patients in the first place. There's a group of enthusiastic, professional, qualified people out there who want to see these patients, and they're of course available where there's easy access at longer opening hours, where these patients can come in and see us at the opticians where they want to go for the regular eye tests.
The patient perspective.
Cost is always an issue, of course, yeah, and the cheaper and the freer it is, the better. But you know, I don't mind paying a small fee for the eye test itself.
Can't afford it. Like students should get like half price.
Just not something I really think about that often, to be honest. I've got pretty good vision. It's not impaired or anything like that, so I don't imagine I need to.
Can you babysit my kids for an hour while I get my eyes tested?
It was scary because they put weird stuff on your eyes.
Especially with younger kids, it's not really made aware as much. It's not really like pushed out towards us as much, so I haven't encountered a single lesson or talk or speech by somebody talking about eye health. I've had loads of talks about sex education and stuff like that, but as far as eye health goes, I haven't had anything really. It's kind of made unaware to me, unless I go out and find that information myself.
We have taken views from the profession and from members of the public in producing this video. We have been really impressed with the passion and with the input from all our professional colleagues.
Improving eye health and reducing sight loss. A call to action.